Hello, everyone. My name is Mike. I'm a physical therapist and your host of the Health Me podcast. Thanks for tuning in, and remember to leave a like and subscribe so you don't miss any updates. Welcome back to another episode of the podcast. This week, I sat down with an integrative psychiatrist to help you understand anxiety, stress, and sleep. To begin our discussion, we will first define the difference between a psychologist and a psychiatrist. We will also explain what an integrative psychiatrist is and how the road to becoming a doctor, ironically enough, is not so healthy itself. For our next guest, she works primarily with people from the highly difficult and fast-paced environment of the tech industry and has created her own company called Pacific Integrative Psychiatry to bring a unique approach to the typical psychiatric experience. Like many other industries, work environments at technology companies can often place a lot of stress, anxiety, and sleepless nights to ensure the job gets done. However, I don't want you to feel like you need to work in a technology company to listen to today's episode. We all share similar feelings about work, life, or even family. I'm hopeful today's episode will bring you clarity and insight on how to seek or ask for help if you're going through a difficult time in your life, and hopefully give you the confidence to know there are ways to change the way that you're feeling. As you will see through today's episode, you will learn about how to identify feelings of anxiety, how to seek help, and learn how to understand physical symptoms you may not have considered. Building off this idea, we will also discuss the wonderful world of sleep and how this can play a vital role in how you cope with work-related stress and how the two are nearly synonymous with one another. To help you achieve a more restful night's sleep, we will identify useful areas that can improve your sleep and go over how melatonin should be used and not abused. A little background before we get into the podcast today. Our next guest is a board-certified psychiatrist and sleep specialist with additional certification in Ayurveda training. She is also the CEO of IntraBalance, an educational platform teaching physicians and health professionals on how they can improve sleep and mental health for their patients. She's also active on social media and has her own YouTube channel aimed toward a lot of what we will cover in today's episode. As always, all links will be below in the show notes. I am happy to introduce to you Dr. Nishi Bhopal. I've been trying to prepare as much as possible for this podcast episode, and in doing so, I've been asking my patients, what if you had the opportunity to talk to a psychiatrist, what would you ask your psychiatrist? And one of the interesting questions that always came up was, well, what's the difference between a psychiatrist and a psychologist? And so I kind of wanted to just start there and kind of get a basis of like, what is a psychiatrist and like, what is the difference between a psychologist?
Definitely. That's one of the most common questions that I get as well as a psychiatrist. And there's a lot of, like, in mental health, it's kind of confusing, right? Because there's so many terms. There's psychiatrist, psychologist, therapist, and what's the difference between all of these? So it boils down to basically that a psychiatrist is a medical doctor. So a psychiatrist went to medical school for 4 years, and then you go on to do residency training in different specialties. So like after med school, you can do you can do internal medicine, you can do pediatrics, and then psychiatry is one of the specialties that you can do. So psychiatrists are physicians that went on to do 4 years of subspecialty training in psychiatry. And then even then they can go on to do further specialty training. So in my practice, I did sleep medicine. So I did a sleep medicine fellowship after psych residency. So psychiatrists, because they're trained medical doctors, we are able to make diagnoses. We can see if there's a medical issue that might be contributing to someone's mental health struggles. So we can see if there's maybe like a thyroid issue contributing to depression or to anxiety, or if there's something else medically going on. A psychologist is not a medical doctor. So they went to grad school after they did undergrad. And so they usually go on to do like a PhD or a PsyD. And a PhD is typically research-based, and then a PsyD is usually clinical. So their training is a little bit different. We're both trained, psychologists and psychiatrists are both trained in mental health conditions and treating mental health conditions, but it's with a different sort of focus. So psychologists can do research, or they can do therapy as well. They often have more advanced training in doing psychological testing, like the MMPI, which is like a personality test, and things like that. So there is some overlap, and I think that's where people get confused. So for people, if you're not sure Like, who should I see? Should I go see a psychologist? Should I see a psychiatrist? Should I see a therapist?
Right.
I recommend go talk to somebody, and then they'll be able to point you in the right direction based on your needs. So if you're not sure, just go and talk to someone, and they'll be able to help you. And it's not that one is better than the other.
Yeah.
So this is the other thing. People ask me like, oh, well, is it better to see a psychiatrist? Is it better to see a psychologist? Both are good. And like I said, we're both trained in different areas. And there's a lot of complementarity, is complementary. So I work a lot with my psychologist colleagues to really support our patients. So again, it depends on your needs. And if you're not sure where to start, go talk to someone and they'll point you in the right direction.
Hopefully, right? And it's not like a psychiatrist is like the wit's end, or like only the bad people go to see a psychiatrist. It's like you guys are all working together collaboratively to make sure that people are getting the help that they need. And regardless who you see, depending on, your necessities, of course, they're going to point you in the right direction to at least know where you need to go and get help.
That's such an important point, that you don't have to have severe symptoms, right, to go and benefit from seeing a psychiatrist or from seeing a psychologist. Like, you don't have to be quote unquote crazy, to see a psychiatrist. I'm biased. I am a psychiatrist, so I feel like everyone could benefit from mental health care, because it's not just about treating severe symptoms, but it's also about optimizing your mental health and well-being.
Well, part of the optimization is you've kind of specialized in this area of integrative psychiatry. And I kind of want to make sure that I'm not getting anything wrong in describing it. So why don't you describe how you've been specializing in this area of integrative psychiatry?
Integrative psychiatry and integrative medicine is just good medicine. That's how I like to think about it, because it really does take a whole body approach. So it takes into account not just someone's symptoms, but what else could be going on in their lives that might be contributing. So whereas conventional psychiatry might ask, what are your symptoms? Integrative psychiatry asks, what are your symptoms telling us? So, in my practice, we look at nutrition, we look at gut health, we look at what's going on in somebody's life, like how are they functioning at work, what's happening with their relationships, and how are all of these things impacting their day-to-day functioning. We look at thought patterns. And so we do some, mindset coaching in our practice as well. Like, how are our thoughts maybe affecting how we're going through life? We also bring in principles of Ayurveda, which is the ancient system of medicine from India. It's the traditional 5,000-year-old system of healing from India. And there's a lot of wisdom in that system as well. So we bring that in. Other integrative psychiatrists might incorporate other modalities like acupuncture, principles from traditional Chinese medicine. So it's quite a large umbrella when it comes to integrative medicine and integrative psychiatry, but it's really the best of both worlds because it doesn't reject conventional therapies, right? So we're not anti-medication or, anti-conventional psychotherapy. Those things can be really, really helpful and life-saving for people. So we do that, and we bring in all of these other strategies.
Now, is other people or other psychiatrists within the realm afraid to dive into those other areas because they don't know about them, or are they trying to think absolutist and trying to uphold the career path of psychiatry? Like, why aren't other psychiatrists just treating the way that you're treating us, so to speak, so that way patients can get better no matter whatever it takes, so to speak?
I think there's a lot of skepticism in the medical field and with psychiatrists and physicians in general. When I talk about things like botanicals or Ayurveda or herbs and things like that, even like the microbiome, there's a lot of skepticism there. People are like, well, that's not really evidence-based. Does that really work? And a lot of these things don't have a ton of research behind them because drug companies aren't funding, research on like herbs or, nutrition. But if you look at sort of the trajectory of medicine, like even 10, 15, 20 years ago, talking about the microbiome was considered kind of hokey, right? There wasn't a lot of buy-in to the idea that your gut health and your microbiome have an impact on your physical and mental health. Now, fast forward, to the present day, and like everyone's talking about the microbiome. There's so much research behind it. So, a lot of these integrative practices do have research emerging behind them or will have research behind them in the future. And I think that's going to help more physicians buy into this approach.
Yeah, and what's really interesting is like even when you the microbiome more specifically, it's just the microbiome works by itself. It's like its own little brain, right? And like a psychiatrist is technically, you're helping your brain. So if a part of your brain's in your gut, you got to kind of have to make sure all the systems are working together efficiently. And I'm not using the best vernacular to describe this, but again, it can work differently. And if it's all working together, contributing to your symptoms, you want to make sure that you're doing everything you can to make sure that your patients are getting better.
That's exactly right. And the microbiome and the gut is your second brain, really, right? And so that's why we get like a gut feeling or a gut instinct,
Right.
because your instincts are kicking in and that brain is working. And specifically for mental health, there's a bidirectional relationship between the gut and the brain.
Hmm.
And this largely happens through the vagus nerve, which is this nerve that kind of connects the two, and it's like a superhighway. So your gut is constantly sending signals to your brain, and your brain is sending signals to your gut. And moreover, the bacteria in the gut produce neurotransmitters. So like, 90% of our serotonin is produced in the gut. About 50% of our dopamine is produced in the gut. So this is why it's so important to optimize gut health and nutrition in order to optimize your mental health and your physical health.
Well, it's also important because another aspect of psychiatry is, at least as I've talked to patients again, preparing for this podcast, is that people think of going to talk to a doctor in general, or even a psychiatrist, they're going to get a pill. And I'm assuming with integrative psychiatry, you're not going right to thinking about pills, or just, you're obviously, you want to help them change the way they think about things, but you're also have this other thing in your back pocket where you can say, we can also change your diet and the way that you're eating. And how have you tried to implement that as well, instead of using medication and not substituting medication? I know there's a line, but I guess how have you been trying to integrate diet and nutrition into changing people's thought patterns and the way that they think about things?
That's exactly right. Like, so medications and pills are one tool that we have in our toolbox. And, like I said before, I'm not opposed to them, and many integrative psychiatrists are not. Like, we do use these medications when appropriate. And a lot of patients come to me because that's the only thing they were offered by their psychiatrist before. Like, they were told, okay, well, we just need to increase the dose of your antidepressant or just try this other medication. And there wasn't any discussion about other things that could have been done. So, we get a lot of patients coming to us because they're either, looking for other solutions, or they're wanting to take medication because it's helped them. But they also want to integrate other strategies. So I encourage anyone, who's struggling with anxiety or depression, or other mental health conditions, to not discount the power of medication, because like I said, they can be life-changing, but also keep in mind that there are so many other factors to take into consideration.
Absolutely. And there's a big story behind that too. And it's like what, how you're perceiving it, the story, and how you're talking to them. Like for instance, for PT, when a patient comes in and they have an injury, like there's multiple different exercises that I can give. And it's not that this one exercise needs to be like, this needs to work. Otherwise, like it's not gonna, like nothing's gonna progress. You're not gonna get better. The pain isn't gonna go away. It's like, this is an option. If it doesn't work for you, we have other tools that are accessible. And with integrative psychiatry, you're using that. And is integrative psychiatry, or are there more providers available than traditional psychiatrists in regards to like access to care? Are people able to access them more freely? Are they coming up more and more often? Or are they pretty like narrow in how many people are doing it right now?
There aren't a ton of integrative psychiatrists out there. And, even in California, like we're both in the Bay Area, you would think there would be a ton of,
Right.
integrative mental health practitioners, because people are just so interested in that approach over here. But there actually aren't a lot of us out there. The numbers are growing because there are more and more training programs coming up in the field of integrative psychiatry. But even until just a couple of years ago, there wasn't even any formal training in integrative psychiatry.
Hmm.
So like when I started out, I was interested in this since my residency days. And so I was kind of just doing my own piecemeal training, just like reading and learning online and taking online classes here and there. And there wasn't any specific program for integrative psychiatry at that time. Now there are more. So we're seeing more and more people go through that training and graduate from it. And that's actually one of the reasons why I started my practice, Pacific Integrative Psychiatry, because there isn't really a home for integrative psychiatry here in the Bay Area. So that's kind of, one of the things that I'm trying to do is create a center both for patients to come and receive this type of care, but also for practitioners to have a place where they can really work in a way that's aligned with their values.
Was there someone or something that made you curious about integrative psychiatry when you're going through your residency? Did somebody introduce it to you before, or was it something that you found on your own?
For me, it was kind of a process of self-discovery. I was struggling with a lot of anxiety and a lot of burnout personally when I was going through medical school and residency. And I discovered yoga. I
Mhm.
discovered yoga and meditation. And through those practices and just kind of doing my own practice and having my own experience with those things, I saw how transformative it could be, right? Like anxiety started to go down. Those feelings of stress and burnout started to melt away. It was really, really powerful and really transformative.
Mm.
Like I'd experienced ways of being that I had never experienced before, and I didn't know were possible. And meanwhile, I'm doing my residency training and I'm going through my rotations and seeing patients in clinic. And I'm like, why is nobody talking about this stuff?
Right.
Or if they were, it was in a very kind of, cursory way. Like we weren't going too deep into integrating these practices into our clinical work. And so it was that kind of prompted me to start exploring. And so that led me down to this path of, exploring Ayurveda, which is that traditional system of medicine from India, exploring yoga and meditation, and learning more about integrative medicine.
I always found it hilarious that in medical school, I have never done it, but I've talked to many people who have, and they always say like, my health went out the window when I went to medical school. And it's like always the exact opposite of like what you're trying
Right.
to promote. And I'm just like, why hasn't anybody from any department be like, maybe we should do something different here? Like maybe like the people who are promoting health should focus on their health a little bit more.
Right, exactly. And I think so that's such an important thing too, right? Like for people who are practicing, like doctors and therapists and so forth, if we're practicing in an integrative way, like I think it's really important that we practice what we preach, that we personally also incorporate these strategies into our own lives. And it's just so much more powerful when you can share your own experiences with your patients.
Well, do you feel like that medicine has tried to normalize that and just like you're going to go through med school, it's going to be tough, and you're going to suck it up, and you're gonna move forward? Is that just part of like the process of just becoming a doctor, and they're like, suck it up, buttercup, here comes the information, here's 4 years from, you're always going to remember kind of thing?
That is baked into the culture. Like that is just how it is.
Yeah.
And so like when you're going through training, I mean, it's been a number of years since I went through medical training, so hopefully things have improved a little bit by now. But back when I was in training, yeah, it was like, we went through this, so you have to as well. Like, why should we make it easier for you? We had to suffer.
Mm.
And it's also a very hierarchical kind of system where you're the lowest one on the totem pole when you're in training. And that sort of attitude and that kind of structure is one of the things that really leads people to burnout. And that's why there's such an epidemic of burnout in medical trainees and healthcare professionals.
Well, not only that, but anywhere. I mean, we're here in the Bay Area and we see a lot of tech professionals, and I'm assuming that's what you see with your business, and see a lot of people who are just dealing with this anxiety. And it's kind of like an undercurrent. I feel I'm not from the Bay Area originally, and having moved here, you see a lot of people like everything's fine and like they're smiling, but there's like fire in the background and everything's like everything's not fine. You can just tell. I guess like what have you seen as working in the Bay Area and having worked with so many tech companies, or people who work at tech companies? What do you see this kind of like same thing with medical school, this built-in level of like there's going to be anxiety and you're going to have to deal with it, and you're going to have to just roll with the punches and see what happens?
I see a lot of that in my practice. Yeah, so we see a lot of people from the tech world, entrepreneurs, from people from the business world. Yeah, and it's baked in again to this tech culture where you're working in sprints, right? Like you're doing these like really intensive projects and working really really long hours, and there's so much pressure on people to perform, and then people end up living their life in sprints. So I tell my tech workers, like, your life doesn't have to be a sprint. And there's almost this expectation that you should have no boundaries, and that self-care is not important. um, and then it leads to a whole host of other things like burnout, anxiety, stress. People have sleep issues. There's this whole epidemic of comparisonitis where you're always comparing yourself to the next person, and then there's these cycles of guilt that kind of set in. So yeah, I mean, it's really pervasive in that hierarchical structure. And sleep when you die kind of attitude, it's really pervasive.
Yeah. Well, how do you manage that? Because I know for myself, there's a part of me that thinks about this often, where it's like, I want to become better. And so I want to work harder. In order for me to work harder, I need to, um, you know, sleep a little bit less, or like, continue to make sure my day is completely filled. And I can imagine similar in the tech world where you're going to be doing the same thing. And so how do you manage the idea of like, I know what's going to make me happy. And it's like, maybe they think they know, maybe this person happens to know that for sure, if they get this managerial role, that they're going to be happy, but getting that managerial role is going to sacrifice their health. How do you navigate that conversation and trying to be like, hey, like, is this what you really want? Or is like, how do you even like go about that?
Yeah, I mean, it starts by really kind of helping a person tune into their own values. Because when you're working in a system like that, whether you're working in tech or you're in medicine or any other system that's really demanding, you kind of lose touch with yourself. You kind of forget why you were doing it in the first place, or what was important to you about it in the first place, or what's really important to you as a human being, not just as a performer.
Right.
So that's usually where where I start the conversation, is by let's revisit that and let's reconnect with that. And let's also see, how you're feeling. Just tune into yourself, because oftentimes when we're working those really long hours, we're almost in this like dissociated kind of state. Like you're just disconnected from your body, disconnected from your physical needs. You don't go to the bathroom for hours, like you're not drinking water, you might skip a meal, you're not getting enough sleep, and you're just totally like out in almost this like out of body type of thing.
Yeah.
So I also start by helping people just kind of get grounded back into their system. And the really important thing for people to remember is that when you take care of yourself in those ways, you're going to perform better. And you're going to be able to do better work in less time, right? So if you want to always tie it back to productivity, that's a way to frame it. And we even know that when people get adequate sleep, they have better cognitive performance. You're more creative. When you're sleep deprived, it's almost equivalent to being intoxicated, to being drunk. Right. So you're not going to show up to work drunk, hopefully.
Right.
Right?
Hopefully,
So,
yeah, right.
Hopefully that's the case for most people.
Everyone shake their head. Yes, please.
Yes. But yeah, so it's really important to take care of those basic needs, and just ask yourself, well, why am I doing this? And what do I really want?
And well, some of these tech companies also they've been trying to be better, right? Like I've heard of a lot of good things from some of the bigger tech companies where they have disposable income to hire psychiatrists or psychologists to help them out in shop. But do you think that could be counterproductive, where like they're even getting like their help from within the company that they're getting stress from? I guess, like, what are your thoughts on that?
I mean, I think that's a good thing. I think anytime there's access to mental health care, that's a positive. And I think especially like for people who are leaders, it's important that you, again, practice what you preach. So if you're like, a team leader, you're the manager, you have direct reports coming to you, if you're encouraging them to go seek help, tune into yourself as well and see, if you can benefit from that kind of support. But yeah, no, I think it's a good thing. As long as it's not performative, like it's not just like, okay, yeah, you went and saw the therapist once, so you're good now. Like it has to be, done in a really
box.
Yeah, exactly. It can't just be a checkbox. It has to be done in an intentional and genuine way.
Well, you mentioned checking in with yourself. I suppose for people who are like at high stress jobs, they're not even thinking about their own mental health. They're just like the goal is in mind. What are some things that you have learned, or at least have tried to identify for people who may not understand that they do have anxiety, or maybe they are, maybe they do have OCD, or maybe they do have these kind of things? Like, what are there things, are there, I don't know, litmus tests or things that people can try and feel that will identify that maybe they should seek help or talk to somebody?
Yeah, there's this one kind of form of anxiety called high functioning anxiety. It's not an official diagnosis, but I see this a lot with people who are high performers, high achievers, working really hard. These are the type of people where no one would think you have anxiety. Like you probably themselves don't even think they have anxiety, right? And they're the people who are dependable, reliable. We know that, you're going to get the job done. We can give you this extra task because you're going to do it without complaining. they have a hard time saying no, right? And setting boundaries. So those are some of the signs to look out for. Like if you're going, yep, as I'm
Yeah.
listing all these things out, that's something to just pay attention to. But the anxiety can also show up in other ways. So it can show up as physical symptoms. So people might notice that they have a lot of tension in their neck, in their shoulders, they're clenching their jaw. You probably see a lot of this in your practice in PT. They might be getting headaches, migraines, back pain, tightness in their hips. That sort of stuff can show up. It can also show up as irritability. So just being a little bit cranky, snappy, your partner might be asking you like, are you okay? Like, or people might be just a little on edge around you. You might notice that you're making careless mistakes, typos in emails, or forgetting to follow up on things. Your performance might not be as good as it normally is. So those are some signs to look out for. Also, avoidance is another one. So if you're avoiding situations, avoiding people, or you're starting to dread things, like you start getting those Sunday scaries, you're dreading going to work, you're dreading meetings, right? All of these are signs that there could be some undercurrent of anxiety.
Interesting. And it's tough, right? Because like you have to be kind of emotionally intelligent to identify those things, right? In order for you to like be like, hey, that I'm sucking on this, or like I'm not getting enough sleep, or like I'm doing these things. And it takes some level of humility to admit that you're not doing well. And are you having these conversations as well where, people are, I'm sure it can be emotionally challenging to just admit that you're not doing well, like things are not going well. And is half the battle just getting the person to admit, not that you want that to happen, but just to recognize like there is something going on.
That's a big challenge, right? To even admit to yourself that like, oh, okay, like something's going on here, or I'm just not myself. So that's a question people can ask themselves, because if you find it hard to even tune into yourself and even know what you're feeling or how you're feeling, you can just ask yourself like, am I feeling like myself? Or when was the last time I felt like myself? And if you identify that you're not feeling like yourself, that could be a sign that there may be something going on. And I think it's so important that we're having this conversation because, again, you don't have to be in a severe, dire state to benefit from mental health care, from talking to a psychiatrist or a therapist. And there's this great organization called Same Here Global, and their hashtag is 5 in 5. And what that means is that it's not just 1 in 5 people who struggle with mental health, it's all of us. It's 5 in 5 of us, because we all experience anxiety or stress or burnout or depression or grief or trauma or what have you at some point in our lives. None of us are immune to that, right? So this notion that 1 in 5 people struggle with mental health, that's kind of the statistic presented by the CDC, that's really not accurate, right? And that can even be more stigmatizing because then it's like, well, I'm not in that 1 in 5, I'm in the 4 in 5, so I'm good. But recognizing that this is a universal struggle for all of us, that we all, have mental health that we need to take care of, that can help to take away some of that stigma. And I think, during the pandemic, so many of us started to realize that, right? Because like people started talking about anxiety and isolation and loneliness and grief and trauma and all of these things because we were going through this global unifying event. So, for anyone who's listening, who's identifying that, oh, maybe there is something going on that I need to pay attention to, what I want people to know is that you are not alone. You are in the 5 in 5, the 100% of us who experience issues with mental health from time to time.
You bring up an interesting point that I kind of want to stick on for a little bit. And there are so many people who have anxiety, and we all experience anxiety. I guess at what point does it become diagnosable that you do have anxiety? Because much like anger, much like sadness, much like all the emotions that constitute the human experience, anxiety is one of them. And I see a lot of people, even in the notes, they'll say like, I have anxiety. And so I'm curious to know more just about anxiety in general, but let's start. And when does it become diagnosable that you do have like it's a diagnosable condition?
That's a great question. Because we all experience anxiety from time to time. So anxiety is protective, right? Anxiety isn't necessarily a bad thing. Anxiety can actually be a very healthy emotion to experience because it keeps us safe. So the brain has evolved to experience anxiety to help us avoid danger or to anticipate danger. And anxiety can be really motivating, right? So like if you have a test coming up, a little bit of anxiety about that, it's going to motivate you to study for the test. Or if you have a job interview, a little bit of anxiety is going to help you, prepare for that interview. So anxiety is not bad. The idea is that we don't want to get rid of anxiety altogether because that wouldn't be healthy. We do need, a good functioning amount of anxiety to help us kind of function at our best in the world. But when does it become a problem? So it becomes a problem when it starts to affect your functioning. So if you're unable to sleep, if you're starting to have some of those physical symptoms that we talked about, like the headaches and the migraines and the neck tension and the difficulty relaxing, if you're having stomach aches, loss of appetite, or it's starting to affect your relationships, people are telling you like, hey, you don't seem like yourself, or like, people are starting to ask you if you're okay, or you're making, mistakes at work, or you're just not showing up because you're avoiding it. So when it starts to affect your functioning in that way, then that's a sign that, there may be something more clinical going on that could use some additional support.
So correct me if I'm wrong. So is the goal then with psychiatry to identify the ways to deal with the feelings of anxiety so that way it can come down to a manageable amount? And then when you do feel higher levels of anxiety, you're able to be like, okay, this is like, you can identify it, you can move through this feeling, and you can continue on with the day. And so if that's the case where we have to manage anxiety to the point where, you're agreeing with me that it's that, why are people having such a hard time identifying that? Are parents not equipping kids enough with the way to deal with anxiety? Is there too much going on in our lives now that we are losing control and with the ability to even like figure out why we have so much anxiety? I guess, like, where do you think this is stemming from? Because again, we don't want to get rid of anxiety completely, because that's silly talk kind of, but we want to be able to manage it. But like, it seems like everyone's getting it. So what are your thoughts on that?
Oh my gosh, that's such a great question. And I mean, there's so many layers to that, right? So, to your point about, well, are parents just not teaching their children about anxiety? I never learned about anxiety growing up, right?
Neither
Like
did I.
yeah, like I was a super anxious kid and super anxious adult until I learned these other, strategies from yoga and meditation and stuff that helped me. It's just not something that we talk about. And in certain cultures, you don't talk about it. Like I grew up in an Indian family. You don't talk about anxiety. You don't even know what that is, right?
Yeah.
It's not taught in schools. Now they're starting to introduce mindfulness and stuff in schools, which I think is amazing. To give kids those tools at a very young age is so powerful. But yeah, so I think that's one aspect, is that it's just not something that we generally talk about, that we're taught as a life skill. But also, like you said, we're bombarded by so much stimuli constantly, right? Like text messages, notifications on the phone, emails, the news, like it's never ending. And our brain has not evolved to manage that much constant stimulation, right? And we don't live in a society where slowing down is valued, where silence is valued, where disconnecting from the greater world in order to connect with our inner selves is valued. So, this is why it's really important that we actually intentionally build those things into our schedule. So I recommend to my patients to do a digital detox. And if you do it for a weekend a month, or do it for half a day a week, or whatever works for you, just take a break from all of that stuff. And I have to force myself to do that too. I have to be really intentional about it, because I fall into that category of like the person who can just be on their computer all day and working, and then like the whole day is gone and you're like, oh, it's 11 p.m. and I haven't gotten, like, I can easily fall into that trap, or a feeling like, oh, my to-do list, I have to get through all of these things before I can relax. And that's just not sustainable. So we need to give ourselves permission to do those things. And one tool that I really kind of help my patients with, and that's really helpful for me too, is self-compassion. And self-compassion it's a research-based, technique. Kristen Neff, Neff, is a psychologist who's done a lot of work in this area. And it's really a great antidote to that comparisonitis thing of feeling like you have to keep up with everyone else. If I take a break, I'm going to fall behind, and that, my coworker is going to get the promotion over me. So self-compassion can help us break free from that kind of false thinking. And I can share a bit more about what self-compassion is, because I think there's a lot of.
No, I think that's very valuable, especially, and also, I appreciate you sharing your personal, because also, again, with me, I try to exercise and be as fit as possible. So it's always good to hear that other clinicians, like you yourself, are also practicing what you preach. So I'd love to hear more about how you're practicing that.
Yeah, definitely. So self-compassion is really about extending the compassion that we would to a friend or to a loved one back to ourselves, right? Because we're usually our own worst critic. Like oftentimes we say things to ourselves that we would never say to a friend or to a loved one. Right. And so it's about bringing that kind of kindness and understanding and empathy to our own selves. And so this can involve just first tuning in and acknowledging how you feel, right? So like you could say to yourself, just acknowledge like, wow, I'm feeling really anxious right now, or I'm feeling burned out today, or I'm feeling stressed out, or wow, I didn't get enough sleep last night. So that's the first step, is just acknowledging what you're feeling, what you're experiencing. The next is to say something to yourself that reminds you that this is a universal experience, right? So like we were saying, 5 in 5 people experience some of these issues at any point in their life. So reminding yourself like, yeah, I'm feeling really stressed out right now, and I know I'm not alone in this, because so many people are experiencing the same thing that I am at this moment. And then the next part is to kind of say something to yourself that's reassuring that you might say to a friend. So it could be something like, I've gotten through this before, I can get through it again. Or, this too shall pass. This is temporary and things will be better next week. And I'm going to allow myself to rest today. It doesn't matter what it is. There's no right or wrong way to do it. But even just taking 30 seconds to do that can have a really profound calming effect on the nervous system.
Well, I find it fascinating that it's language, and it's like self-talk, and it's talking to other people, and it's the power of language that allows us to work through physical symptoms and physical things in our brain. And what have you learned about language, having, tried to practice this yourself, but also help to implement this with patients that you're seeing?
Well, the thing is that, the thoughts that we have and the words that we say actually do have a downstream effect in the body, right? So if you're thinking stressful thoughts, or you're saying hurtful things to yourself, that's going to create a biochemical cascade. That's going to increase your stress hormones. That is going to, increase your cortisol and your adrenaline and all of these other things that then have physical effects on the body. And this is why approaches like mindset coaching or CBT, cognitive behavioral therapy, which is something that I work on with my patients, that's why these things are so powerful, because the way that we think about a situation affects how we feel about the situation, and then how we react to it. And then it can become a vicious cycle, right? So it can almost become a self-fulfilling prophecy. Like when my brother and I were little, we used to play Mario Kart, like on the Nintendo.
Like everyone else, yeah, right.
Yeah. So we loved playing Mario Kart, and there was this one, it might have been like Rainbow Road, or like, one of those tracks.
Rainbow Road, oh yeah.
Where, I was like, oh, I always fall off at this corner. And just that thought, if I always fall off in this corner, I would always fall off in that corner.
Right, exactly.
And my uncle said to me, he said, if you think that, then that's going to happen. And I was like, oh, really? Okay.
Was your uncle a psychiatrist?
So that was kind of like my first introduction to CBT as a kid.
Right.
But it sounds so simple, right? But
right.
It's really true that if you can start to change the way that you talk to yourself and the way that you think about situations, it can actually change your experience of life.
And do you think that writing them down would also be helpful? I've remember I remember I found my old computer one time, and I remember feeling super stressed. And I was like, I just need to get it all out there. So I opened up a note and I wrote down everything I was thinking, like just went to town, like wrote like 2 pages of just nonsense. And then went back and read it, and I was like, I'm a completely different human. Like, I don't know what the heck I was thinking. And I thought that was kind of powerful. Do you value writing down your thoughts and maybe going back and reflecting on those?
Journaling is such a great tool, right? Whatever you want to call it, writing things down, you can call it scheduled worry time. That's the actual formal name from cognitive behavioral therapy.
Mm-hmm.
You can call it doing a brain dump, you can call it journaling, writing in your diary, whatever you want to call it. But yeah, it's really effective and really powerful for a couple of reasons. One, it's just cathartic, just to give yourself that space to dump out all the thoughts that are in your head. But it also can help you make sense of what's going on up there. Like,
Yeah.
again, I'm someone who I have a very active mind, and sometimes it can just run away with me. And for me, writing things down is a great way to just organize my thoughts, and help me plan what I need to do next, kind of work through that to-do list. Or if I'm, feeling something, or if my patients are experiencing something and they're not really sure what they're feeling or why they're feeling it, starting to write it down can bring you clarity and perspective. So
Mm.
yeah, I think that's a great tool.
And
It's a good one. Oh, sorry, I'll just add one more thing to that,
yeah.
which is it's really great for people who have trouble falling asleep at night.
I was
If
just
their
gonna say
mind is
that. I
racing.
was like, anytime I'm like laying in bed and if I have like so much in my mind of like what I gotta do the next day, I like whip out my phone, I put on a note section, I just type everything I gotta do, and then I'm out. It always works. I don't know
Yep.
why. It's always something that I've done, but you can continue and explain maybe like the science behind it or why that works.
Yeah. So yeah, it's a really great tool. So if you have trouble falling asleep because your mind is racing, then taking a few minutes, like 5 or 10 minutes after work. I don't usually recommend doing it right at bedtime because sometimes it can activate the mind a little bit more,
Mm.
but doing it sometime during the day, just, give yourself that intentional space to write out all the stuff that's going on in your head. Um, that can help just kind of get it out there so that you've given your mind that space to process those thoughts. Because one of the reasons that people tend to have those racing thoughts at night is because you've been so busy during the day
Mm.
with other things, like people are busy with work or with their kids or other activities. You just haven't had time to think about that stuff. So then it all percolates up at night when you're idle and when things are quiet. So you can actually build in that time during the day to do it. And then if you are the type of person who, you wake up thinking like, oh, I have to follow up on that email tomorrow, or, oh, I have to go buy milk or whatever.
Right.
Can't forget to do that. Writing it down so you can keep a little notepad and pen by the bedside, or it's a good idea not to do it on the phone because you don't want to get sucked into that, because it can be really tempting just to open your phone and then, oh, let me just check email quickly or to see what's happening on Instagram or whatever. So
Yeah.
it's a good idea just to have a pen and paper next to your bedside. And that way your mind doesn't have to hold on to that thought, because sometimes just trying to hold on to like, oh, I shouldn't forget that thing, I need to remember that can actually rev up your nervous system. So it makes it harder to fall back asleep.
Interesting. Well, I wanted to also ask like why you wanted to get involved in kind of like sleep. Like when did you start to realize like the importance of sleep and how it was going to play a vital role in psychiatry and how you practice? Because now you specialize in it and it's something that you talk about often. So like when did you become curious about sleep?
I've always been interested in sleep since I was a kid, just because I was always a sleepy person.
Mm.
I was always sleepier than my peers. I'd want to come home after school, take a nap. Even in university, I really struggled with getting up on time to get to classes. I grew up in Vancouver, Canada, and I was a commuter student at UBC, University of British Columbia. And I'd have to like either drive or take the bus. And I was always late for my morning class and I'd be so sleepy during the day. So sleep has always been something that, was kind of a personal issue for me. And then when I was doing my medical training, especially my psychiatry residency, I saw how so many of my patients were struggling with sleep. And I also saw how transformative sleep was for them, because there's a bidirectional relationship between sleep and mental health. So
Mm.
when people aren't sleeping well, mental health gets worse. And then when people are struggling with mental health, sleep gets worse. So the two things feed into each other. So I just got really interested in sleep. And one of my senior residents, when I was doing psych, was on to do a sleep medicine fellowship. And I was like, what is that? That's a thing?
I want to get a PhD in sleep.
Yeah. I'm like, you can do that? Okay. So she kind of introduced me to this idea of sleep medicine as a specialty. And it turned out there was a really great sleep lab and sleep clinic where I was doing my residency at Henry Ford Hospital in Detroit. And so I started doing rotations there, and that kind of sparked my interest. And what I love about sleep is that it's so multidisciplinary, because there's the psychological aspect, there's the physiological aspect with, breathing and oxygenation. There is the neurological aspect with, the different types of brain waves that you see. There's the circadian rhythm, which is the body clock. And that really ties back to Ayurveda, which is that ancient system of healing from India, because they were so tuned into the circadian rhythm and body clock. And what they knew 5,000 years ago is so aligned with what the modern understanding is of the body clock. So there's just so many fascinating aspects to it. So that kind of prompted me to study it further. And so now that's something I bring into my practice, where sleep is a really important and fundamental aspect of the work that we do with our patients.
Yeah, I've been trying to improve my sleep, but it's also been something that I found curious and just funny that we just decided to like shut off our whole body and be like, oh, well, I need to recover, and like just be like done. We don't just keep going. We have to be like, we need to recover and just like completely knock ourselves out. But I wanted to get back to anxiety as well as sleep. And now, do people who have anxiety always have sleep issues, and or are they always correlated? Is it kind of or is it a larger, a big array of people who, anyone can fall on anywhere on the spectrum?
Yeah, so there is a very strong correlation between anxiety and sleep issues. And I'd have to pull up the statistic now, but I think it's something like almost like up to 80% of people with anxiety struggle with sleep issues at some point. And another really interesting statistic there is that sleep deprivation can induce anxiety. So even if someone doesn't necessarily have an anxiety disorder per se, a sleepless night can increase their levels of anxiety the next day. Furthermore, getting a deep night's sleep can actually reduce a person's anxiety levels the next day. So there is, a pretty strong correlation between the two. And one of the reasons for this is that, sleep is not a passive process. Like we think of it as just kind of falling into the state of oblivion, and then like you're out for, 6, 7, 8 hours, and you wake up and you're ready to go the next day.
Sounds like me.
Yeah, right. Yeah, that's good. That's good.
Yeah.
But, sleep is very active. So when we go to sleep, the brain goes to work and it starts clearing out toxins that build up during the day. So it sweeps out like proteins like amyloid beta that are implicated in the development of dementia later in life, Alzheimer's dementia. So sleep is a process to actually clear out all of those toxins that build up. During sleep, the blood pressure goes down, so it helps to regulate the cardiovascular system. People with high blood pressure should be checked for sleep apnea, especially if they have treatment-resistant high blood pressure, because that dipping, it's called the dipping of blood pressure at night, is really important for blood pressure regulation during the day. During the sleep, the immune system is regulated, and there's studies showing that when people are sleep deprived, they don't respond to vaccines as readily. And people, might need another dose of a vaccine to get the effects if they're chronically sleep deprived. Or if they haven't gotten enough sleep just even a few nights before the vaccine. So that's super important right now, during this pandemic that we're still kind of going through. And then, sleep also helps with repairing muscles and tissues. So for people who are athletes, or if you're exercising, working out, you need that rest so that your body can physically repair itself. And then also during sleep, you consolidate memories. So if you're learning something, whether it's something physical, like learning, you're practicing your tennis swing, or learning how to play golf, or learning how to ride a motorcycle, or if you're learning a new language, or, you're studying for your exam, or whatever, sleep helps you consolidate those physical memories and also the, the other cognitive memories as well. So there's so many things. I mean, the list goes on. This is just scratching the surface of what happens during sleep, and it's still kind of a mystery. We don't know all the things that happen during sleep, but it's such a fundamental, important process. And this is why I tell people, especially my high performers, my tech executives, that you don't want to skimp on sleep. If you want to be on your A game and you want to perform at your best, you need to make sure you're making sleep a priority.
Yeah, I like the way that you put that it's like you're going to sleep, like you're out, but your body's active, like your brain is, it's like time to go to work, and it's a completely different aspect. But even with like some of my patients who are constantly expressing that they're having pain, that can be a whole nother conversation where we talk about pain and, anxiety and how in sleep and how it contributes to that. But certainly it's an aspect that I try to ask patients as well, is like, are you getting enough sleep? Like that's also a part of training. Like that is like making sure that you're fully recovered to perform at your best when you need it. And that certainly needs to be talked about a lot. But you do say that there's this correlation where 80% of people potentially have sleep issues if they have anxiety. How often is it that you have an individual who, because they're sleep deprived, they have anxiety, versus someone who has anxiety and they have a sleep issue? Like how often are you seeing each of them, and are they often like, how do you just like discriminate between the two? Because both, I'm assuming, need different interventions.
Yeah, that's a really good question. So it's kind of hard to tease out one from the other because they are so intertwined. So I get people who come to me for help with sleep and they don't, identify as having anxiety, right? So they'll say like, oh, I have trouble sleeping. I don't feel rested. I wake up too frequently during the night. Now I always start with a root cause analysis to see, what's going on, to make sure there's not some medical issue
Sure.
that's causing it. But oftentimes what I see is that these people are really struggling with anxiety, right? And then sleep is it's like a manifestation of their anxiety. Like I had one patient who came to me and said, I have like a list of like 30 different things that I have to do before I go to bed in order to sleep. I'm like, okay, that sounds very stressful.
I'm stressed. Yeah.
Like, okay, if you don't do it all perfectly, you're not gonna be able to sleep. That sounds very like stressful and anxiety provoking to me, right? So sometimes sleep issues can show up in that way. And conversely, people who are struggling with anxiety, sometimes they can start to develop a fear of sleep because sleep is also a process of letting go. You're vulnerable during sleep. People who have experienced trauma might not experience sleep as a safe space to be. So there's that relationship as well. So this is why cognitive behavioral therapy for insomnia, CBTI, is so effective. And so CBTI is a specific type of therapy. It's different from your regular cognitive behavioral therapy. It's a specific protocol for insomnia. And it's really good at kind of managing that anxiety around sleep. And actually studies show that when people do CBTI, they also experience improvements in their mood, and it can help with reducing symptoms of depression. And it also can prevent the onset of depression, even though it's specifically for sleep.
Does that fall within the category of like integrative psychiatry, or is that in a traditional role as a psychiatrist?
So CBTI is considered a conventional therapy. So it's kind of one of the standard therapies that's used in sleep medicine. A person doing CBTI has to be specifically trained in it. So there's a specific training for cognitive behavioral therapy for insomnia. So usually those are behavioral sleep specialists that do that training. And it's really complementary to an integrative approach. So like for me as an integrative sleep doctor, I like to kind of look under the hood, as I call it, to see, are there micronutrient deficiencies? Are there issues with the microbiome? Are there other mental health, challenges that we need to be addressing? Are there medications that could be causing issues with sleep? And so doing that in conjunction with CBTI can be really, really helpful for people.
And you said medications with sleep. One thing that people have been taking since the dawn for a very long time recently is melatonin. Do you recommend melatonin use? And if so, are there places that you can reliably get it? I know supplement industries aren't always the most reliable in regards to dosage and so on. So what are your thoughts on melatonin?
Yeah, so melatonin, it's super common for people to take it. There was actually a report that came out recently showing that there's a great deal of variability in what's actually in the supplements. Like sometimes it can contain 400 times more than what it says, or way less than what it says.
Right.
So I recommend to people, if you're going to be taking a supplement, whether it's melatonin or something else, to use a professional grade supplement. or at least one that's been third-party tested.
Okay.
So I have a video on my YouTube channel about like what to look for with third-party testing and supplements. So I don't have to go into all detail about all of that, but with melatonin specifically, okay, so melatonin is a hormone. It's produced by the brain. It's produced by the pineal gland in the brain naturally. And it's not a sleep aid, it's a body clock regulator. So it tells our brain and our body when it's time to go to sleep. So it's produced naturally in an environment of darkness. So that's why you want to dim your lights in the evening after sundown to help promote your body's own natural production of melatonin. Now, melatonin supplements can be helpful in certain cases. So it can be helpful for realigning the circadian rhythm or the body clock. So for like teenagers, young adults, or even, older adults who are struggling with a delayed body clock, like if you can't fall asleep till midnight, 1, 2, 3, 4 o'clock in the morning, and then you can't get up before noon, like you're sleeping until 2 p.m., that could be a sign of a delayed body clock. So a little dose of melatonin, timed correctly, can help pull that body clock earlier. On the flip side, older adults often get what's called advanced sleep phase syndrome. So it's just more common in older adults. And so that's when people fall asleep too early and then they wake up too early. So they're falling asleep at like 8 p.m. and then they're waking up at 3 or 4 in the morning. And they're like, but I want to go to bed at 10 and wake up at 6. So using melatonin at the right time can help push their sleep phase later. So melatonin supplementation can be helpful in those situations. But for the person who's kind of just, struggling with sleep, or they just want a little bit more support with sleep, less is more. Because I often see patients who are taking like 3, 5, 10, 20 milligrams of melatonin, which is way too much.
Yeah.
And that's, multiple fold times what the body produces. So I usually, when I recommend it to a patient, I usually use doses of like 300 micrograms or 500 micrograms. I rarely go above 1 milligram of melatonin. Timing is really important, because if you're taking it at the wrong time, it can throw your body clock off rhythm.
Yeah.
And so, it's not something that I recommend for long-term use. There aren't a lot of studies looking at using it for more than about, 8 weeks. That's generally what most studies have looked at. So it depends on what you're using it for, is kind of the short answer there. And if you feel like you're struggling with body clock issues, then it's a good idea to talk to a doctor who understands this and knows how to use melatonin correctly.
Just another great tool, right? Something that will allow you to figure out what's wrong with you and be able to steer you in the right direction. Are there other supplements or other foods that perhaps you found that have been helpful to aid in sleep and help people, get out of this ugly habit of not being able to sleep well?
Yeah, so there's research showing that foods that are high in saturated fat and that are high in refined carbohydrates and sugars can cause more sleep disruption. So these are your cookies, your cakes, your pastries, your potato chips. These types of foods can actually make sleep worse. Now, that bidirectional relationship applies here too, because when you're sleep deprived, you get shifts in the leptin and ghrelin hormones that affect hunger and satiety. So they affect like how full we feel after we eat. And so when people are sleep deprived, we get more ghrelin, which makes us feel hungry, and less leptin, so we feel less full, and we start to crave those types of foods that actually are bad for sleep. So there is that bidirectional relationship. Foods that are higher in fiber are shown to help improve deep sleep, so deeper restorative sleep. And then also there's some evidence supporting the fact that a Mediterranean diet, which is high in fresh fruits, vegetables, whole grains, healthy fats, olive oil, that type of thing, actually can promote better quality sleep. So, it goes back to those fundamentals of, like eating real food, eating lots of plants, not eating things that come out of packages. You can also avoid heavy meals 3 hours before bedtime, because if you eat way too close to bedtime, it's going to disrupt sleep. But you also want to be mindful of regulating blood sugar. So having, a high fiber snack like an hour before bed can sometimes help as well with sleep quality. So that could be something like vegetables and hummus, or banana with nut butter, that type of thing. So I think this is just a really interesting area of research that's going into food and sleep. And then there's also research looking into the microbiome and sleep. I always think microbiome is so interesting. So yeah, so there's a lot that people can do there. I always just recommend to people though, just to start by noticing. Just tune into yourself and just notice. Just pay attention to your habits, see how things work for you, because there's no one size fits all approach.
Well, one question I would ask would be, or like one counter thing would be to say like, well, I'm too busy. Like I got these kids, I can't eat healthy and like, da, 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 da. So I guess, would you recommend like, in order for you to help get steered in the right direction, that most people should try and like at least have a conversation with a psychologist or psychiatrist to at least get them put in the right direction, or at least balance all of these things that we talked about today, because again, people are overwhelmed already in their everyday lives. And even for me, like trying to get patients to do like that one exercise, it can be challenging, right? So I guess, do you recommend having somebody in your life that you're able to go and talk to and discuss, have a conversation like this, so that way you can start heading in the right direction?
I'm always an advocate for that. So yeah, I
Yeah.
mean, if people are willing to do that and talk to somebody and get some guidance, and just kind of get another set of eyes on how you're doing, I think that's always a good thing. And then I also encourage my patients to just let it be easy. You don't have to do all the things all at once. And I see this with my high performers, right? They're like, okay, give me the 30 things that I need to
Yeah.
do,
Right
and I'm
before
going to go
bed.
do them. Yeah,
Right.
yeah. And like, that's just not sustainable. Like, start with one thing. And, I struggle with this too. Like, when I see my functional medicine doctor, like, but what else? What else should I be doing? How about this? How about that? And she's like, no, just start with these one or two things and incorporate them into your life, so then it becomes a habit. And then you can layer on the next thing.
Hmm.
And it's just much more sustainable that way. And also, you're controlling the variables to see what works for you and what doesn't.
And you're getting another pair of like another mind just thinking about it, right? Like you can play tricks with yourself all day long. I know I do it, and I'm sure everybody else does too, where you're like, I don't need to do it this week, or like I don't need to do
Yeah.
that now. Like you'd play these little mind games with yourself. And have you maybe gotten curious as to why we do that? Maybe as to why we try to self-deprecate, or kind of like not help ourselves in that way? Is it a part of this, like just this thought pattern of in this language that we talk to ourselves as, and maybe we don't feel like we deserve it, or what are your thoughts on that?
Well, the brain doesn't like change.
Mm.
Like, we get kind of used to our own routines and our own way of doing things, and our own thought patterns. And to create a new habit or to make those changes can be unsafe, because we're doing something different and the brain doesn't know what's going to happen if we do something different. Right. And so then the safety mechanism is, well, let's just stay in our cocoon. Let's just stay in our cave,
Yeah.
because maybe it's not great, but we know what it is. We don't know what's on the other side. So I think that's part of it, is that safety mechanism. Sometimes perfectionism can get in the way, right? Like, people can fall into these all or nothing patterns. Like, I have to do it every day or there's no point. And life just doesn't work that way. So, I recommend to my patients just to, be compassionate with yourself and give yourself a little bit of space. And if you fall off one day with your workout or your meditation practice or whatever it is, that's okay. And just do it again tomorrow. Just give yourself that space, to go at your own pace.
Giving yourself empathy, right? Like just giving yourself a break, right? Like just being like, it's going to be okay. There's going to be tomorrow, and you're going to be able to try to knock it out of the park then. And it doesn't always have to happen now. It's not an excuse, right? Like it shouldn't be your excuse to your cop out, right? Because that could be your enemy too, right? It'd just be like, never do anything. But again, it's that idea of forgiving yourself, being empathetic, and understanding that you are just human, and we're all trying to figure this out all at the same time.
Yeah, that's exactly right. And also connecting back to your values. Like we were saying, we were talking about this before, about, well, why are you doing this in the first place? Like, why were you starting this meditation practice? Why were you starting this exercise routine? What were you wanting to get out of it? And so reconnecting with that vision or that goal, can help you get back on track. So self-compassion and having empathy for yourself is not about giving yourself a free pass. So I think that's kind of like a common misconception of like, well, if I'm not hard on myself, then how am I going to achieve anything? So it's not about that. It's about, giving yourself that empathy and compassion so that you can be motivated in a positive way to keep going with whatever change you're trying to make.
Well, I love that you've established your values, and I love that you're implementing that alongside with all your patients. And I wanted to ask you, you've been practicing for a little while now, and you also deal with some of these high performers, and, you do have all this experience with sleep. I guess, what has been one thing that surprised you the most practicing as a clinician? And maybe whether it's a patient where you're like, I didn't think this was going to work, or maybe it's, a different way about thinking about things. Like, what's been something that surprised you the most practicing as a clinician?
Hmm. Oh, that's such a great question. I would say that sometimes it's the things that you don't realize that you said that have the biggest impact on patients. And so sometimes people will come back to me and they'll say like, oh, you said this thing like 2 months ago that stuck with me. And I'm like, I did? What? I don't even remember that. So sometimes it's not just the, recommendations that we give people, the practices that we tell them to do, but it's about how we said something or how we, just connected with them as another human that has the biggest impact. And so I think that's been one of the most surprising things for me, just practicing over the past number of years, because they don't really teach you that in medical school, right? Like,
surprise,
you're taught how to like make a treatment plan and all that kind of stuff. But sometimes those aren't the things that have the biggest impact on people.
Interesting. Yeah, I find that to be true a little bit sometimes too, is like where, I said something during the eval and they're like, well, you said this then, and it's been like 8 weeks or 10 weeks. And I'm like, how do you remember that? And so it's interesting it's like almost like having a kid, in that they're always paying attention. They're always going to kind of reiterate what you're going to say. So again, back to the same idea where the language is really important. You got to make sure that, what you're saying and conveying is true to your values, and making sure that you can always fall back on them. So that way you always have something to fall back on, so to speak. So that way, when they do question you, you're like, yeah, this is, I still hold these values to be true.
Right.
Well, listen, thank you so much for coming on the podcast today. I mean, I hope that today was informative for people who want to talk more about mental health and want to learn more about it. And, obviously these conversations need to continue, and we need to continue having more conversations, not only with other clinicians, but also other patients. So again, I want to thank you for coming on the podcast today. We're going to finish off with 3 final questions that I'd like to ask everybody. I gave you a little time ahead of time to kind of take a look at them. First question is going to be, if you had the attention of everyone in the world for 30 seconds, what would you say?
So I would tell people not to worry so much about what other people think of you, and give yourself space to explore your full potential, because you're more capable than you realize. And allowing yourself to do this is the best way that you can be of service in this world.
Love it. Love it. So, second question, what book do you recommend, whether you're reading now or in the past?
Right now, I'm reading Joy at Work by Marie Kondo and Scott Sonnenschein. And because I love organizing and decluttering, and I'm constantly doing that in my house. And this book is full of interesting tips. It's super helpful. But what I really love about it is that they turn this process of decluttering and tidying into a process of personal development. And it's almost like a spiritual process. So yeah, I recommend this book.
You're going through a spiritual process of cleaning your house.
Yes, I am.
Last question. Where can people learn more about you, and find information that you put out all the time?
I have a private practice. It's called Pacific Integrative Psychiatry, and we see patients all over California. So pacificintegrativepsych.com. I'm also on YouTube, so you can find me there at Intra Balance, so INTRA Balance on YouTube. And then I also have a holistic sleep course called the Holistic Sleep Reset. You can find information about that on my website and on YouTube.
All great information. Make sure to go give her a follow. And again, I want to thank you for coming on the podcast today. It was a really great time.
Yeah, thanks for having me. This is really fun.